I think it's first important to discuss what many people don't understand very well, which is rice itself has a form of gluten in it. This chart or this diagram that you're looking at here lists out the different grains, okay, and the different types of gluten found in the grain. And you can see rice contains a type of gluten called orzonin, and by concentration, it is the lowest percentage of gluten found in grains. You can see some of these others are much higher. Wheat at 69, corn at 55. You can see oats at between 12 and 16, etc. But rice lower than them all at around 5% total gluten, for the protein content. And so rice is typically ignored, and a lot of people think, oh, I can eat rice and I do just fine. And again, there are more than one reason. One of the reasons why I would say avoid rice is because of the fact that it has gluten. And remember, we talked about this just a few weeks ago. Gluten causes damage at 20 parts per million. That's the size of a breadcrumb, and that damage can last for up to 2 months. And again, this is one of the reasons why so many people going on that traditional gluten-free diet, right? They go get their diagnosis, their GI doctor says you need to be gluten-free, so go learn about it on the internet. They go learn on about the internet, and everybody says rice is gluten-free. Everybody talks about how gluten-free rice is, and the problem is rice is not gluten-free. Rice is gluten-free, and most people, when they're talking about gluten, are referring to the wheat gluten, gliadin, but rice definitely has a form of gluten in it. Now, aside from that, now that we know that rice technically is not gluten-free, let's talk about some of these other things that you need to be aware of. So, when people go gluten-free, okay, one of the things that happens is right here, this number 2, is processed food becomes the go-to. They're jumping at anything they can find that has a gluten-free food label on it in the grocery store. And most of the time, these processed quote-unquote gluten-free foods, because they're technically not gluten-free, but they contribute to malnutrition and diabetes. And the problem with that is when you're learning about gluten and you're trying to change your diet, you're trying to do so to improve your health. You're already in a state of malnutrition. This is already your problem. And so when you gravitate to all that processed rice-based food, you're just adding to the issue of malnutrition. So you're just adding flames or adding fuel to the flames, so to speak. Remember this, so coming down here from 2 to 4, as much as, and this is research backed, so as much as 92% of those following a gluten-free diet continue to have health problems that are persistent. Now, we'll go even beyond that. Some people feel better even though they're eating rice, they're not eating wheat, barley, and rye. But when they get a biopsy, so when their doctor, when they get that celiac diagnosis and they do a follow-up biopsy, as much as 92% of the time, these people have persistent atrophy, persistent damage to the intestinal villi. This is in some cases 18 months after they've been on this diet, in other cases up to 5 years after being on the diet. So it's important to understand one of the reasons why that happens is what you're choosing and what you're buying and what you're choosing to call gluten-free. There's no such thing as gluten-free rice. Technically, it's not gluten-free. It plays a major contributing factor in this number right here. This vast majority of people going gluten-free continue to have issues. But one of the other things that we see is right here in this number 6 is that processed food. There are a number of different studies that have been done on this, and I think the one I've read that was the highest was that of packages that were pulled off the grocery store shelf, these were packages that were labeled gluten-free, and as high, the highest, is up to 41% of these packages were cross-contaminated with enough wheat and barley and rye to create a reaction. And so again, a lot of these food products, so like these processed foods, are rice-based products. So I know some of you, maybe your minds are being blown right now. You probably want to hit me. You probably want to scream at me because I'm just here maybe taking away one more food. You don't shoot the messenger. I'm not taking away anything from you. I'm trying to educate you. Again, rice contains a form of gluten called orzonin. People going on a gluten-free diet traditionally, 92% of them fail to recover and have persistent atrophy, and up to 41% of foods that are labeled gluten-free, many of which contain rice, are cross-contaminated with enough wheat, barley, or rye to create damage. Remember, how much does it take to create damage? Look at that. Gluten can cause damage in doses as low as 20 parts per million. That's the size of a breadcrumb. So it doesn't take much. And again, if you go back and watch what we talked about a couple of weeks ago, which was how long does it take gluten to get out of your system when you gluten yourself, you're looking at 2 months, potentially 2 months of inflammation. So if you are the rice junkie, buying the rice noodles, the rice pasta, the rice breads, the rice cereals, you want to check yourself, especially if you're still struggling to try to recover. Okay, I want to share with you some of my experience. I've been seeing patients now for 21 years clinically, and this is what I see. These are the top symptoms that I see when people have gone, we have a name for it, when they go gluten-free, the right way, we call that true gluten-free, the true gluten-free diet, because what this really means is they're avoiding corn and rice and sorghum and some of the other things that are oftentimes labeled gluten-free. But most people, when they start, they don't know this information, and they follow what we would call a traditional gluten-free diet. Traditional gluten-free diet is what you learn on the web. It's what you learn about from most major websites as far as the traditional definition of gluten. Most of these sites are citing information as old as early 1950s. They're pulling the science from that time frame and applying it into today's knowledge base, and it's wrong. It's not accurate. And so it's why we have the differentiation between true gluten-free diet and the traditional gluten-free diet. But in my 21 years of experience, this is what I have seen in terms of rice exposure. Persistent muscle and joint pain, muscle cramping, nerve pain, migraines, brain fog, skin rashes, stomach pain, diarrhea, constipation, blood in the stool, and intermittent low-grade fevers. And sometimes, when I share a story with you, a little anecdote, it's a little girl, a little infant baby. Her mom was just terrified because this little girl had gone gluten-free, had taken her traditionally gluten-free, right? Wheat, barley, rye-free, but they were giving this little girl a meal replacement powder because she was a really picky eater. And the meal replacement powder had rice in it. It was one of the top ingredients, and she brought it into me because she wanted to know should she keep giving this food to her child. And it was the first thing I looked at. It was the first ingredient I saw. My eyes just drew right to it. And I was like, this little girl needs to get off this product. And what was happening to this little girl? She would spike fevers, 103, 104 degrees. They were taking her in and out of the ERs because her fever kept spiking. And the doctors kept thinking she had an infection. They didn't know what to do with her. They were pumping her full of antibiotics. I mean, we're talking about 5-6 trips to the ER, over a year's period of time before this little girl was brought into my office. Well, she was following, again, a traditional gluten-free diet. She was avoiding the wheat, the barley, the rye, those things, but she was eating every day. One of her major staple foods was a protein powder that contained rice. And the second we took that out of her diet, she never went back to the ER. She never had a mysterious fever again. So I share that with you because this is actually, I've seen this a number of times, especially in children. And so you just want to be aware it's a symptom that can persist despite going on a gluten-free diet if you're not keeping tabs on the rice. So rice, very, very important to get that out of your gluten-free diet. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.